Greetings and welcome to today's section. Today we are looking at some of the common questions that were tested in pediatrics between the period between January and April 2025. So let's get right into it. Question number one. A parent asks the nurse how they know if the child has developed infectious mononucleosis. The nurse explains that in addition to fatigue, which symptom will be the most common, infectious mononucleosis. It's also referred to as the kissing disease, and in this case, it is enlarged lymph nodes. Remember that infectious mononucleosis usually has an insidious onset with fatigue and the inability to maintain usual activity levels as the most common symptoms. Lymph nodes are typically enlarged, and the spleen may also be enlarged. Fever and sore throat are often do accompany mononucleosis. A persistent non-productive cough can follow an upper respiratory tract infection. The bluish-like generalized skin rash is more characteristic of rubella more than infectious mononucleosis. Question number two. A 29-month-old child who is dehydrated as a result of vomiting requires oral dehydration. Which concept regarding oral dehydration therapy should the nurse consider? Out of the four options, the first one is the most appropriate one. You give 1 to 3 teaspoons. That is averagely 5 to 15 ml of fluid every 10 to 5 minutes. Giving small amounts of fluid at frequent intervals is the first action a nurse should take when a child is vomiting. Doing so will allow the nurse to observe the child's tolerance level. Simple sugars aren't a good source of hydration because of their osmotic effects, so the nurse shouldn't wait 72 hours before taking action if a child is vomiting or has diarrhea. Toddlers can become dehydrated in a short time, so a healthcare provider should see a child whose vomiting or diarrhea persists for uh, 24 to 36 hours. Wet diapers are a good source of determining hydration. However, 3 wet diapers each day isn't normal finding for toddlers. A hydrated toddler should have 6 to 8 wet diapers per day. Question number three is that the nurse is caring for a client with cystic fibrosis who has increased dyspnea. Which intervention should the nurse include in the plan? Difficult in breathing with dyspnea, right? This child, the nurse should be able to perform chest physiotherapy. Airway clearance techniques are treatments that help people with cystic fibrosis stay healthy and breathe easier. So, um, so we have to loosen the thick, sticky lung mucus that is the characteristic of cystic fibrosis so that it can be cleared by coughing. Clearing the airway reduces lung infections and improve lung function. Routine scheduling of airway clearance using chest physiotherapy is an essential intervention for clients with cystic fibrosis. Fluid restriction will worsen the thickening of secretions and sanctioning the upper way will not reach the thick secretions in the lower lungs. Acid chloride test is normally used to diagnose cystic fibrosis, but is not a treatment. Number four, the nurse provides discharge teaching to the parent of a toddler after insertion of bilateral tympanostomy tubes. Which instruction should the nurse include in the child's discharge plan? They need to insert earplugs into the canals when the child breathes. Placing earplugs in the ear will prevent contaminated bath water from entering the middle ear through the tympanostomy tubes and causing an infection. Inserting cotton swabs into the ear canal is not recommended. Antibiotics may be given for a short period after insertion and are and are appropriate only when an ear infection is present. Tenoplasty tubes may remain in place for several years. It is not necessary to administer antibiotic continuously to a child with tenostomy tube. So drainage from the ear may be a sign of a middle ear infection and should be reported to the healthcare provider. An adolescent client who is being seen by the crisis nurse after making several superficial cuts on their wrist states that all their friends are siding with their ex-partner and will not talk to the client anymore. The client says that although they know the relationship is over, if I can't have my ex, no one else will. Which client problem takes the highest priority? It is risk for other directed violence. The threat towards the ex-partner is the most immediate concern now. As the client turns their anger towards their ex-partner instead of themselves. Although situational low risk esteem, risk for suicide, and risk-prone health behavior are evident, these problems are less of a concern at this time. A preschool child immobilized in a hip spica cast has trouble breathing after meals. Which action will be the best for the nurse to take? Well, you need to offer the child small feedings several times a day so that a hip spica cast normally extends up and over the abdomen. And because the abdomen is in a fixed space, abdominal distension secondary to eating pushes the abdominal contents against the diaphragm. And this results into decreased chest expansion and subsequent possible respiratory distress. The child's problems are associated with the meals, so offering small, frequent meals provide nutritional support while minimizing distension. Encouraging increased drinking will increase abdominal distension, thus increasing the child's respiratory distress. Pastly breathing will prevent air trapping, not decreased chest expansion. Administering a laxative with meals will not relieve the decreased chest expansion. Number 7 is that a nurse is teaching a new parent about intussusception. Which signs and symptoms should the nurse include? Intussusception, we have abdominal distension and vomiting. Intussusception occurs when a portion of a bowel slides into the next like the pieces of a telescope. So when this occurs, it can create a blockage in the bowel with the walls of the intestines pressing against one another. This leads to an abdominal swelling, inflammation, and decreased blood flow to the part of the intestines involved. Additional symptoms of intussusception could include vomiting, passing of stools mixed with blood and mucus, and grunting due to pain. Number 8 is that which action should the nurse take in the immediate period following application of a plaster cast to correct a child's congenital club foot? The immediate one is to change the child's position at least every 2 hours. Complete drying of a plaster cast takes several hours. So that's turning the child with a new applied cast at least every 2 hours helps the cast to dry uniformly. The cast must not be coated with any substance that will inhibit moisture evaporation from the plaster. Dryers are not used to dry the cast because they dry the cast on the surface but not underneath. Furthermore, heat may be conducted to the tissues through the wet cast, causing burns. The drying cast must be handled with palms, not only to prevent finger indentions that could cause pressure areas. So you use the palms and not the fingers. Number 9, we have the nurse observes a child with Duchenne muscle dystrophy. who attempts to rise from a sitting position on the floor. After attaining a kneeling position, the child walks their hands up to their legs to stand. The nurse documents these signs as which one? Okay, among these signs we have the Goa sign. This is the Goa sign. With Goa sign, the child walks the hands up the legs in an attempt to stand, which is a common approach used by children with Duchenne muscle dystrophy when rising from a sitting to a standing position. When you talk of the Galaz sign, this one refers to the shortening of the affected limb in a congenital hip dislocation. The golden sign refers to the softening of the cervix, which is considered a sign of probable pregnancy. The good enough sign refers to a test of mental age. After teaching the parent of a child with a spica cast about skin care, which parental action will indicate the need for additional teaching, right? Which one is wrong? So which one is wrong according to the teaching? Application of a powder to the skin under the cast. Remember I said nothing should be applied. So powder should not be applied to the skin beneath the cast because the powder can cause irritation and skin breakdown. The parent will need further teaching about avoiding this measure. Checking the smoothness of the cast edges, covering the cast around the perineum, and inspecting inside the cast are all appropriate action for the child with a spica to help prevent skin breakdown. Number 10, which technique will be the most appropriate to use when determining whether teaching the parents about how to administer eardrop correctly has been successful? So we are looking for the correct teaching. And the correct teaching is you observe the parents instilling the drops in the child's ear. So written demonstration are the best way to evaluate a person's ability to perform a task. This technique enables the teacher to observe not only the learner's sequencing of the steps of the procedure, but also the learner's ability to perform the skill. Listening to the parents describe the procedure, asking them to list the step, or asking them if they have read the handout will not ensure that they can perform the procedure. So we always look at the written demonstration. So during a well baby visit, a parent asks the nurse when the infant should start receiving solid foods. The nurse should instruct the parent to introduce which solid food first. Okay, based on the ones that have been listed, you start with the rice cereal. Remember, the nurse should instruct the parent to introduce rice cereal first. Why? Because it is easy to digest and is associated with very few allergies. Next, the infant can now receive peeled fruits such as bananas, apples, and the pears, followed by the peeled vegetables, now egg yolks, cheese, yogurt, and finally meat. Egg whites shouldn't be given until 9 months because they can trigger a food allergy. The emergency department nurse has admitted an infant with bulging fontanelles, setting sun eyes, and lethargy, which diagnostic procedure will be contraindicated in this patient. Alright, so lumbar puncture. Remember, the child is exhibiting signs and symptoms of increased intracranial pressure, ICP. A lumbar puncture is contraindicated in children with increased ICP due to the risk for herniation. Magnetic resonance imaging, MRI, and computerized tomography, CT scan, are indicated in children with suspected increased intracranial pressure. Radiology studies will allow visualization of the cause of the increased ICP, such as inflammation, tumor, or hemorrhage. An arterial blood draw is not indicated in this client. However, there is no contraindication for performing an arterial blood flow on a child with increased ICP. So the concept here was knowing that we are dealing with a child with increased intracranial pressure. A parent is concerned about spoiling a 2-month-old child by picking up the child each time the child cries. Which suggestion should the nurse offer? Now, based on the 4 options by the nurse, we go for option B. Nurse B says you continue to pick up the crying child because young infants need cuddling and holding to meet their needs. So the nurse should advise the parent to continue to pick up the crying infant because a young infant needs to be cuddled and held when crying. Because the infant's cognitive development isn't advanced enough to associate crying with getting attention, it will be difficult to spoil the infant at this age. Even if the diaper is dry, a gentle touch may be necessary until the infant falls asleep. Crying for 10 minutes wears an infant out, so ignoring crying can make the infant mistrust the caregivers and the environment. Infant cries for many reasons, not just when hungry. So parents shouldn't just assume that the infant is crying for hunger. A child is diagnosed with nephrotic syndrome. When planning the child's care, the nurse understands that the primary goal of treatment is to, in nephrotic syndrome, you reduce the excretion of urinary protein. Remember, this condition is normally characterized by proteinuria, right? So the primary goal of treatment for a child with nephrotic syndrome is to reduce excretion of urinary protein and maintain protein-free urine. Nephrotic syndrome isn't associated with hematuria, cardiac failure, or hypertension. Fluid restriction isn't warranted here. A nurse is assessing the heart rate and the rhythm of an 8-year-old child. Here's a mama that's barely audible even in a quiet room. The child's heart rate is 80 beats per minute. The nurse should document her findings as, yes, the heart rate is regular. We could say of the grade 1 mama is auscultated. So a heart rate of 80 beats per minute is considered normal for an 8-year-old child. In this age group, bradycardia is typically associated with a heart rate of less than 70 beats per minute. So a grade 1 mama is barely audible in a quiet room. Grade 2 is faint but clearly audible. A toddler receiving chemotherapy after surgery for a Wilms tumor has developed neutropenia. The parent is trying to encourage the child to eat by bringing extra foods to the room. Which food will the nurse discourage for this reason? Neutropenia, infection prevention. Look at that. So we are looking at the fresh strawberry. And when a client is receiving chemotherapy, they develop neutropenia. Eating uncooked fruits and vegetables may pose a health risk due to the possible bacterial contamination. You look at the other foods that have been listed here, they are either cooked, pasteurized, and will not produce a health risk. A diagnosis of hemophilia type A is confirmed in an infant. Which instruction should the nurse provide the parents as the infant becomes more mobile and starts to crawl? All right, type A. Bleeding precautions, right? You sew the thick padding on the elbows and the knees of the child's clothing. As the hemophilic infant begins to acquire motor skills, falls and bumps increase the risk of bleeding. Such injuries can be minimized by padding vulnerable joints. Aspirin is contraindicated because of its antiplatelet properties, which increase the infant's risk for bleeding. Because genitourinary bleeding is not a typical problem in children with hemophilia, urine testing is not indicated. Although some bleeding may occur when with the tooth eruption, it does not normally cause moderate to severe bleeding episodes in children with hemophilia. The nurse is assessing an adolescent who has been diagnosed with aplastic anemia. What should the priority assessment for the nurse? Aplastic anemia. Signs and symptoms of infection. Aplastic anemia results in lowering of all the blood counts, causing the adolescent to be neutropenic. So neutropenia often leads to infection, which can be life-threatening. So this is a priority for the nurse. Decreased cardiac output from septic shock is a real threat. Nutritional Nutritional deficits are difficult to correct where the client is acutely ill. Electrolyte imbalances and weaknesses do not occur with pancytopenia and acute illness in the hospitalized client. These are corrected on a daily basis and are considered urgent when effects such as arrhythmias are likely. An adolescent should be independent in self-care activities whenever possible, but this is a low priority for a client who is ill. When a child presents with respiratory distress in a hospital, which one of the following statement will be false? Steroids are the best treatment for, for bronchiolitis, right? A child, steroids are not the standard treatment for bronchiolitis. It's majorly of viral cause. So supportive care, including hydration, oxygen therapy, is the mainstay of treatment. Bronchodilators or steroids may sometimes be tried, but they are not universally recommended. The nurse is planning pre-operative care for a client diagnosed with Wilms tumor. What is the nurse's most important intervention? As you plan, you avoid the abdomen. You don't palpate the abdomen and manipulate it any. After diagnosis of Wilms tumor, the abdomen should not be palpated at all. Palpation of the tumor could lead to rupture, which will spread cancerous cells throughout the abdomen. If surgery is successful, long-term radiation and chemotherapy will not be required. Enteral feedings and total parental nutrition are not part of the preoperative treatment of Wilms tumor. Radiations and chemotherapy are not started preoperatively. A child with Wilms tumor has had a kidney removed and is now receiving chemotherapy. What priority information should the nurse share with this child's family at this time of discharge? They should avoid contact sports because the child has only one kidney. Certain precautions are recommended to prevent injury to the remaining kidney. Fluid intake is essential for renal function and should not be decreased. The child's sodium intake shouldn't be reduced. Avoiding other children is unnecessary. This may make the child feel self-conscious and lead to retrogressive behavior. A child has just returned to the pediatric unit following placement of a ventriculoperitoneal shunt for the hydrocephalus. The child is placed in a supine position. What is the nurse's priority intervention? They should place the child on the side opposite the shunt. And following the shunt replacement, the child will be placed on the side opposite of the surgical side. And this is just to prevent pressure on the shunt valve. Intake and output will also need to be assessed, but that is not the nurse's priority. The child is usually on nothing but mouth status until an NG tube is removed, bowel sounds have returned. Also, pain medication should be administered by an intravenous route initially post-operatively. Teaching, if able, begins preoperatively. If not, teaching is not the first nursing intervention when returning to the pediatric unit. An infant undergoes surgery to correct an esophageal atresia and transesophageal fistula. Which nursing diagnosis has the highest priority during the first 24 hours? Infective airway clearance has the highest priority in immediate postoperative period. The infant's airway must be carefully assessed, and frequent suctioning may be necessary to remove mucus while taking care not to pass the catheter as far as the suture line. The nurse should assess breath sounds, respiratory rate, skin color, and ease of breathing. Because of the skin of the risk of edema and airway obstruction, you keep a laryngoscope and endotracheal intubation equipment readily available. There could be impaired tissue perfusion from the edema, but keeping the airway patent is the priority. The risk for aspiration is present, but a risk does not take priority over the actual nursing diagnosis. Imbalanced nutrition can occur because the infant is unable to ingest any food. Nutrients must be provided via an enteral or a parental nutrition, but this diagnosis does not have priority over the airway clearance. A school-aged client with a diagnosis of epilepsy is admitted to the pediatric unit of a local hospital for an evaluation of anticonvulsant medication. As the nurse enters the client's room, the client begins to have a seizure. What is the priority nursing action? You should loosen any restrictive clothing. Okay, the primary goal during a seizure is to protect the client from any physical injury and maintain a patent airway. So loosening the clothing, especially around the neck, will allow free movement and aid in keeping the airway open. The other primary intervention to prevent injury are raising bed rails if the client is in a bed, or easing the client to the floor and placing a soft object under the head. After making sure that the child is safe from injury, the nurse should push the call light if further assistance is needed. The nurse should never forcefully hold a client down, since the force of the child's movement against the restraint could cause muscle strain and even joint dislocation. The nurse also should not force the jaw open. The nurse is preparing to feed an infant diagnosed with pyloric stenosis prior to surgical repair. What is the nurse's most appropriate intervention? You bump the infant frequently. These infants usually swallow a lot of air from sucking on their hands and fingers because of their intense hunger. So bumping up frequently will reduce gastric distension and increase the likelihood that the infant will retain the feedings. Feeding should be given slowly with the infant lying in a semi-upright position. Parental participation should be encouraged to the extent possible, but this will not increase the likelihood that the feedings will be retained. You need to record the type, the amount, and the character of the vomit as well as its relation to the feeding. The amount of feeding volume lost is usually fed to the infant. A client ingested a large amount of acetaminophen at 1 a.m. 2 hours later, the client comes to the emergency department and is diagnosed with acetaminophen poisoning. What is the priority intervention for this client? You need to administer acetylcysteine. No. If the client is seen within 1 hour of ingestion, maybe we could use activated charcoal to prevent absorption, or gastric lavage can also be used. Blood work will be obtained but wouldn't be the first priority. Intravenous fluid will also be administered, but administering acetylcysteine, that is the specific antidote for this acetaminophen poisoning, is the priority in this case. A 2-year-old client with pneumonia is placed on oxygen at 2 liters via the nasal cannula to maintain an oxygen saturation of not less than 95, right? The nurse notes that the oxygen saturation has been between 97 to 98 for the past 4 hours. What is the correct action by the nurse? You need to remove the oxygen and reassess oxygen saturation in 15 minutes. Because the nurse has a prescription to adjust the oxygen based on the oxygen saturation, there is no need to ask the healthcare provider for additional prescription. Given the saturation is several percentage points higher than the prescribed 95, the nurse can try removing the oxygen and checking the client's response. The nurse should not administer oxygen that is not needed. What is the most important intervention for a nurse to implement while caring for a neonate with omphalocele? You carefully position and handle the omphalocele. Remember, this is the same precaution you're supposed to employ when you are handling a patient with Wilms tumor, right? Careful positioning and handling prevents infection and rupture of the omphalocele. The omphalocele should be kept moist until the neonate is taken to the operating room. The parents can see the defect if they so choose. Palpation of the omphalocele increases the risk of rupture and infection. That's why care should be taken place there. What is the most important intervention for the nurse to include in the care plan for a male infant following surgical repair of the hypospadias? We need frequent assessment of the tip of the penis. So following the hypospadias repair, a pressure dressing is normally applied to the penis to reduce bleeding and tissue swelling. The tip of the pen should be assessed frequently for the signs of circulatory impairment, and the dressing around it is initially changed by the surgeon themselves and shouldn't be changed every 4 hours thereafter. The provider will determine when the suprapubic catheter will be removed. Urethral catheterization should be avoided after repair of hypospadia to prevent trauma to the repaired urethra. A seven-month-old infant, male infant, female infant is admitted to the hospital with a tentative diagnosis of heat-sprung disease. When obtaining the infant's initial health history from the parents, which statements made by the parent would be the most consistent with the diagnosis of heat-sprung disease? The heat-sprung disease, she gets constipated often. You know, infants with heat-sprung disease typically have a history of abdominal distension, constipation, periodic diarrhea. When that is when liquid fluid leaks around the semi-obstructed colon, failure to thrive. So having an occasional cold is not unusual for an infant and is not related to heat-sprung disease. Spitting up once in a while is not unusual for an infant. A rectal temperature of 37.4 degrees Celsius will be considered normal. The parent of a 2-week-old infant brings the child to the clinic for a checkup. The parent expresses concern about the baby's breathing because the infant breathes quickly for a while and then breathes slowly. The nurse interprets this finding as an indication of which factor. This is a normal pattern in a normal breathing pattern in infants of this age. Remember, the infant is exhibiting periodic breathing, which is normal in infants of this age. The infant typically alternates short periods of rapid, louder respirations with periods of slower, quieter respirations. So since the finding is normal, there is no need for a monitor. You just close the parental monitoring, do close parental monitoring or just X-ray, right? No need. This is normal breathing. A mother and a grandmother bring a 2-month-old infant to the clinic for a routine checkup. As the nurse weighs the infant, the grandma asks, "Shouldn't the baby start eating solid food? My kids started on cereal when they were 2 weeks old." Which response by the nurse should be the most appropriate? Where the babies can't digest solid food properly until they are 4 months old. So starting the baby's can stating that babies can't digest food properly is the correct, because infants younger than 4 months lack the enzymes necessary to digest complex carbohydrates. This is also a time when the extrusion reflex disappears. The baby will not push the food from the mouth. A baby should not wait. A baby should not wait until 9 months of age to start solid food. This can cause an aversion to solid foods and lead to the baby not getting enough nutrients for the growth. Saying that things have changed is a cliche that may block further communication with the grandmother. It is also rude and indicates that the nurse doesn't think the grandma was a good mother. Stating that introducing solid food early leads to eating disorders is incorrect because no evidence suggests that this occurs. Stating solid foods early does, however, have a link to obesity later in life. An infant is admitted to the hospital with dehydration secondary to viral gastroenteritis. Which room assignment is the most appropriate for this client? Gastroenteritis, right? Should be in a private room. Remember, viral gastroenteritis may be communicable, and all the other children that have been listed here are already at risk for an infection. The infant should be placed in a private room. A nurse is assessing a 6-month-old infant at a well baby check. The parent says that the infant has been having diarrhea for the last 2 days. Which is the nurse's priority action? Just assess, collect more information from the parent about the diarrhea. The nurse should obtain a more detailed history and assessment on the infant to determine the next steps in care. Routine teaching, use of the emergency department, or notifying the primary healthcare provider is not a propriety. It's not a priority until diarrhea is evaluated. An infant returns from surgery after repair of a cleft palate. What is the priority nursing intervention? Position the infant on the side. Infant should be positioned on the side, and this is to allow oral secretion to drain from the mouth. Suctioning should be avoided. Pacifiers should not be used because they can damage the suture line. Arm restraints should be kept on to prevent the infant from disrupting the suture line. A postpartum mother is concerned about a noted decrease in her breast milk production, which response by the nurse best addresses the mother's concern. You decrease supplemental feeding with formula. Guys, routine formula supplementation may interfere with establishing an adequate milk volume because suckling the breast stimulates prolactin production. So prolactin is the hormone responsible for milk production. Vitamin C levels haven't shown to influence milk volume. One alcohol beverages generally tends to relax the mother and facilitate the milk letdown reflex. But excessive consumption of alcohol may block milk letdown, though supply isn't necessarily affected. Frequent feedings are likely to increase milk production. So breastfeed more. A new mother states, "My baby spits up every feeding." Which nursing intervention should the nurse teach to this mother first? You need to bump up the infant more frequently during each feeding. Frequent bumping decreases the amount of air the infant has in the stomach and should be the first intervention. Feeding smaller portions more frequently may help if the infant is taking larger amounts. Infants should be fed every 2 to 4 hours. Elevating the head of the bed 30 degrees may help if the cause is gastroesophageal reflux. Formulas may have to be changed if it is determined that spitting up is related to milk intolerance. The breastfeeding parent of a 1-month-old is diagnosed with cow milk sensitivity. Ask the nurse what they should do about feeding their infant. Which intervention will be the most appropriate? They have to continue to breastfeed but eliminate all milk products from their own diet. So the parents of an infant with a cow's milk allergy can continue to breastfeed if they eliminate cow's milk from their diet. It is important to encourage birth parents to continue to breastfeed because breast milk is usually the least allergic and most easily digested food for an infant. In addition, the infant is able to obtain protein through the birth parent's milk. If the parent stops breastfeeding, a pre-digested protein hydrolysate formula will be the first choice. An iron-fortified formula is a cow's milk-based formula. A soy-based formula is not used because approximately 20% of infants with a cow's milk sensitivity are also sensitive to soy. Solid foods are not introduced until the infant is about 4 to 6 months of age. A school-age child with phenylketonuria is eating lunch. The child has the following foods on the lunch plate. Which of the following foods choices should the nurse question the child for choosing phenylketonuria? Right? Fried chicken legs. Children with phenylketonuria may not consume animal proteins. Right? Must not consume animal proteins. Children with phenylketonuria are unable to digest phenylalanine, which is an essential amino acid. The amino acid primarily is found in the animal protein. Because the amino acid is essential, the child must consume some phenylalanine, but the children's serum levels are monitored to make sure that the levels do not become dangerous. If children's levels do exceed safe levels, the children will experience cognitive deficits as well as others. A nurse is performing newborn screening for phenylketonuria. Which of the following action is the nurse performing? Right? Of course, collecting blood from the heel stick on a 2-day-old baby. Blood collected by the heel stick on a 2-day will be sent for newborn screening. Blood is sent for a newborn screening in all the 50 states in United States, although the list of diseases assessed is not consistent from the state to state. One disease that newborn blood is assessed for in all the states is the phenylketonuria, because a child with phenylketonuria does not possess the enzyme needed to digest phenylalanine. The amino acid remains in the baby's bloodstream. The amino acid is found in formula and in breast milk. So in order for the test to be accurate, the baby must have consumed the protein for 24 hours. Babies should and therefore be at least 24 years old before the blood is sent for analysis for this phenylketonuria. The nurse is instructing a 4-year child about an upcoming procedure. What approach should the nurse employ during the teaching? You just use simple terms, right? When explaining a procedure to a 4-year-old child, the nurse use simple terms that the child can understand. Speaking gently may ease the child, but this is not the most important. Distracting the child with a toy is more appropriate during the procedure than before it. Because preschoolers have limited attention span, the child should provide only the necessary basic facts, not colorful details to prevent anxiety. A parent is concerned about spoiling a 2-month-old by picking up and this child, right? Because we said we continue to pick up the crying baby because these young ones need cuddling and holding to meet their needs. A client who is admitted to the adult unit of a mental health facility with depression tells the nurse that he has pedophilia. What should the nurse do? You just need to be aware of the personal views and the personal views, because personal opinions and views when caring for clients with this psychosocial disorder. The care plan for the client will be developed to manage both the depression and the pedophilia. It is not necessary to restrict the client's interaction with others or on this adult mental health unit. The healthcare provider will determine the type of therapy that will be most appropriate for this client. When planning counseling sessions with adolescents, the nurse must incorporate measures to consider which abilities: capacity to deal with abstract possibilities, right? That ability to deal with abstract possibility develops during adolescence. So assimilation and accommodation are characteristic of an infant's sensorimotor development. Representational thought is associated with the preconceptual phase of development from ages 2 to 4 years. Problems of conservations are part of concrete operations learned by children between ages 4 and 7 years. For the child experiencing excessive vomiting secondary to pyloric stenosis, the nurse should assess the child for which acid-base balance. Excessive vomiting, that is metabolic alkalosis. It occurs because of the excessive loss of potassium, hydrogen, and chloride in the vomiters. Chloride loss leads to a compensatory increase in the number of bicarbs. Bicarbonate side of the carbonic acid base, bicarbonate increases and the pH becomes more alkaline. Respiratory alkalosis is caused by conditions such as hyperventilation that result in loss of partial pressure of arterial carbon 4 oxide. Respiratory acidosis is caused by conditions such as inadequate ventilation that result into excessive retention of partial pressure of carbon 4 oxide. Metabolic acidosis results from loss of large amounts of bicarbs, such as with severe diarrhea. A nurse admits an infant diagnosed with pyloric stenosis. What is the nurse's priority intervention? Weighing the infant, because this will be done first, so as a baseline. This will act as a baseline weight and can be established, and the weight changes can be evaluated. After the baseline weight is obtained, an IV catheter can be placed because of oral feedings generally aren't given. Infants with pyloric stenosis are usually dehydrated, so weighing up the diaper or checking the specific gravity, though important, are not a priority. The nurse is providing teaching to an expectant mother about breastfeeding. Which statement made by the mother would require immediate follow-up? Which statement is wrong? Remember, a link will be popping up for the breastfeeding steps for successful breastfeeding and breastfeeding position. So, which statement is wrong and requires follow-up? When the client says that I have been HIV positive, HIV positive for 4 years. C, it strongly, someone with HIV is strongly discouraged from breastfeeding because of the risk of transmitting the infection to the neonate, unless it's from the third world countries where breastfeeding is the only guarantee to nutritional component of that particular baby. So that will be discouraged and that will be looked at. A multiparous client 48 hours postpartum who is breastfeeding tells the nurse, I'm having a lot of cramping. This didn't happen when I nursed my first baby, which will be the nurse's best response. The cramping is normal and is caused by your baby suckling, which stimulates the release of oxytocin. The cramping is caused by the baby suckling and subsequent stimulation of for the release of oxytocin. So this cramping is normal. With subsequent pregnancy, the uterus becomes more stretched and the release of oxytocin causes the uterus to contract, resulting in the feeling of cramping that can become more severe with each birth. Continued moderate to large amounts of lochia rubra are indicative of retained placental fragments. Cramping indicates that the uterus is contracting and most likely firm. A boggy uterus, that is continued moderate to heavy lochia, mild vasoconstriction and restlessness, and anxiety suggests delayed postpartum hemorrhage due to subinvolution of the placental site, retained placental tissue, or an infection. Most clients receive standard dose of oxytocin after birth. And oxytocin has a duration of about 60 minutes. Therefore, the effects of the drug will have worn off by 24 hours postpartum. After the nurse counsels a primiparous breastfeeding client about diet and nutritional needs during the lactation period, which client statement indicates a need for additional teaching, which teaching is wrong. I should drink at least 5 glasses of fluid daily. For breastfeeding client, drinking at least 8 to 10 glasses of fluid a day is recommended. Breastfeeding women need an increased intake of vitamin D for calcium absorption. A breastfeeding client requires an extra 500 calories a day above the recommended non-pregnancy intake to produce quality breast milk. Breastfeeding women need adequate calcium for blood clotting and a strong bones and teeth. After 2 days of breastfeeding, a postpartum client reports nipple sores, which client statement indicates an understanding of the measures to help relieve nipple sores. The correct teaching: I should lubricate my nipples with express milk before feeding. Measures that help relieve nipple sores in the breastfeeding mothers include lubricating the nipples with a few drops of express milk before feedings, applying ice compresses just before the feedings, and letting the nipples air dry after feedings, and lastly, avoiding the use of soap on the nipples. A client tells a nurse that she is going to breastfeed her neonate, but she isn't sure that what she should eat. Which client statement requires further teaching? Which statement is wrong? I will take all the same medication I was taking before my pregnancy. Right? The client indicates she needs additional teaching when she states she will resume taking all medication she was taking before her pregnancy, because most drugs are excreted through breast milk and may affect the neonate. The client should consult with her physician before taking any drugs while breastfeeding. She should also increase her daily calories by 500, drink about 10 glasses of fluid, and include milk products in her diet to increase her milk production, and also provide adequate nutrition for her neonate and herself. A breastfeeding mother who is experiencing breast engorgement asks the nurse if there is anything she can do to get relief. What is the best intervention for the nurse to implement? Breast engorgement. You teach how to express the breasts. Teaching the client how to express her breast will facilitate milk letdown and provide temporary relief. Ice can promote comfort by decreasing blood flow, numbing, and now this will discourage further letdown of milk. It's not recommended because it also causes the rebound reaction of a more letdown once the ice is removed. Breast binders are not effective in relieving the discomforts of engorgement. Bromocriptine is no longer recommended for lactation suppression. During a postpartum parenting class, a client tells the nurse that to save the cost for the formula, the client has switched her 6-month infant from formula to cow's milk, Which of the following statement made by the nurse will be the best? The best statement. Cow's milk can 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 be safely given to an infant older than 1 year. Do not give cow milk to someone who is less than a year. The quality and the quantity of nutrients in a cow's milk differs greatly from those of human milk, and the cow's milk does not contain many of the various growth and immunological factors found in human milk. With regard to nutritional content, cow's milk contains great amounts of protein and minerals and small amounts of essential fatty acids than cow's milk. Cow's milk has low iron content and the iron is poorly absorbed. So to lower the risk of iron deficiency anemia, cow's milk is not recommended before 12 months of age. Which finding indicates that a client who has been raped will have future adjustment problems and need additional counseling. When her parents or people around her show shame and suspicion about her part in the rape, the potential for problems in adjusting after rape will be increased when those around the victim treat her as though she is to blame for the rape, especially when she already may feel some guilty and shame about it. A rape victim is likely showing adjustment to her experience when she is upset about her experience, when she seeks out formerly ignored relatives and friends for support, or when she attempts to help others rape patients. The nurse notes that a girl, 8-year-old, is exhibiting signs of precocious puberty. If left untreated, the nurse is aware that the young girl is at high risk for which of the following complication? Short stature, right? Short stature is seen in children with precocious puberty. When children mature early, their growth plates will close prematurely. As a result, their stature are lower than their genetically expected height. A young boy who has been diagnosed with growth hormone deficiency is to receive synthetic growth hormone. When providing medication teaching to a boy and his parents, which of the following information should the nurse include? Educate the boy and his parents regarding the rationale for the administration of the subcutaneous injection. The child will receive growth hormone subcutaneous injection at bedtime 6 to 7 times each week, because growth hormone naturally is produced by the anterior pituitary gland during the period of sleep. The injection of growth hormone for those children who produce deficient supplies is administered at bedtime. The vast majority of children who are treated for growth hormone deficiency are majorly males. A nurse is educating a young boy about the assessment required to make a diagnosis of growth hormone deficiency. Which of the following information should the nurse include in his or her teaching? An X-ray of the child's wrist will be performed, right? To determine whether the child's growth is complete. An endocrinologist will X-ray the child's wrist. The growth plate will be assessed to determine whether the child has reached his or her maximum height. A child with type 1 diabetes has been diagnosed with ketoacidosis. Which of the following laboratory findings is consistent with this diagnosis? pH of 7.24. Ketoacidosis normally results when the body is devoid of circulating glucose, and as a result, it goes into fat metabolism. When ketones, the byproduct of fat metabolism, rise in the bloodstream, the pH of the blood will drop precipitation. Client XY, a 2-year-old child, has been diagnosed with type 1 diabetes. The nurse is providing education to the parents regarding the signs of hypoglycemia. Which of the following information should the nurse include in the teaching session? Child's behavior will resemble a burst of anger or temper tantrum, right? Caring for toddlers with type 1 diabetes can be difficult because the children's daily behavior often mimics signs of hypoglycemia. For that reason, parents must be forewarned to consider hypoglycemia as the reason for the child's aberrant behavior rather than simply a phase that the child is going through. The nurse must first consider which characteristic of an adolescent in order to assist the teenager to deal with the diagnosis of type 1 diabetes. Adolescents need to be like peers. Right? They need to be like peers is the driving force for the adolescent and is greatly influences acceptance of compliance with a prescribed diabetic regime. Desire for independence and future orientation of goals are also important elements to consider when caring for an adolescent, but they do not outweigh the adolescent's need for acceptance and sameness with his peer group. Adolescents do not feel the need to please parents and may, in fact, be somewhat hostile towards parent and other authority figures. A 10-year-old with a newly diagnosed type 1 diabetes asks why he must take shots every day when his aunt with diabetes gets to take tablets. The nurse's best response is that you have a different type of diabetes than your aunt does. Your type needs insulin shots every day because this is type 1. The aunt probably could be having type 2. So diabetes is a complex of subject and a newly diagnosed 10-year-old child needs repeated explanation and with reinforcement before he is able to grasp the concept of types of diabetes. Neither maturation nor growth of the pancreas supplies the insulin that the child is unable to produce. So lack of understanding of the child process is to be expected in anyone who is newly diagnosed with a disease such as diabetes. Also, this answer sounds like a put down and asks a question that closes communication because it calls out for yes or no, which we say they are not parts of therapeutic communication. An 8-year-old child with type 1 diabetes actively played during a recess but presents to the school nurse with complaints of headache, feeling shaky. The nurse's first action should be to just give the child a simple carbohydrate snack. You have to know that the child is displaying the symptoms of hypoglycemia. So a simple carbohydrate elevated the blood glucose level and also alleviate the symptoms. The simpler the carbohydrate, the more rapidly it will be absorbed. 4 sick children with type 1 diabetes have been admitted to the hospital. Which child is most at risk of developing hypoglycemia? Hypoglycemia with any bacterial sepsis. Child with bacteria is at increased risk. You see, children with bacterial sepsis have bacteria in their bloodstream. So most bacteria normally utilize glucose for fuel because the bacteria would be consuming much of the glucose in the blood in the child's bloodstream. He or she should be at the most risk of developing hypoglycemia. The school nurse is responsible for caring for a number of children with type 1 diabetes. Before which of the following activities should the nurse make sure that a child consumes a snack? Right, where we are going to have vigorous exercise, playing soccer in a soccer team, they have to take that. Aerobic exercise improves utilization of glucose by the cells of the body. As a result, during active exercise, children need insulin, need drop. So to compensate for the reduced insulin demand, the child should consume an extra snack. A nurse T is providing education to 4 sets of parents whose children have been diagnosed with type 1. The nurse should provide follow-up teaching to the parents who state that they should perform which one of the following. Alright, which parent have said the wrong thing? Parents of a 2-year-old child who say that we will have our daughter prick her finger for each glucose testing. Even though the disease state reference in this question is diabetes, the question really relates to growth and development issues. So the nurse should be familiar with the abilities of children at different ages. So at 2 year old, they are still too young to prick their own fingers for glucose testing. So what about the short answer question we had describing steps of IMCA strategy, explaining any 4 types of pediatric emergencies, explaining the stages of development according to Jean Piaget. Well, the integrated management of neonatal and childhood needs is a strategy that has a holistic approach to managing childhood illnesses. So we normally assess the child assess the child by taking a thorough history and assessing for danger signs such as inability to feed, convulsion, lethargy. Later, you conduct a physical examination focusing on the key symptoms such as fever, cough, diarrhea, and malnutrition. After you have assessed, you classify, so you categorize the child's condition into color-coded groups, e.g. red for severe conditions needing urgent referral, yellow for conditions requiring treatment, green for mild illnesses that can be managed at home. Then you proceed to identify the treatment for the child, then you treat the child. So you administer pre-referral treatment for severe illnesses. It could be antibiotics, antimalarials, provide specific treatment for the identified condition, e.g. the oral rehydration for diarrhea, the antipyretics for fever. You counsel the caregiver, like educate the caregiver on how to administer prescribed medications, continue feeding, identify danger signs requiring follow-up. Then do the follow-up, schedule follow-up visits to monitor progress, ensure compliance, assess treatment outcomes. Health promotion, you promote preventive measures such as immunization, breastfeeding, good hygiene, and the use of insecticide-treated bed nets. Community involvement, you work with the community to improve access to healthcare and promote healthcare education. Strengthening health system. You train healthcare workers and ensure the availability of essential drugs and equipment. Next, types of pediatric emergencies. You could talk of respiratory emergencies like severe asthma, bronchiolitis, foreign body as airway obstruction. Symptoms include difficulty in breathing, cyanosis, and stridor. So here you need immediate management, which includes airway clearance and oxygen therapy. Number two, could talk of cardiac emergencies. Examples include congenital heart defects leading to heart failure or arrhythmias. Symptoms could include chest pain, palpitations, or shock. Management involves stabilization, medication, and possible defibrillation. Neurological emergencies like seizures, meningitis, head trauma. Symptoms could include altered consciousness, convulsions, neurological deficits. So immediate treatment could include use of the anticonvulsant, the lumbar puncture for suspected meningitis. Gastrointestinal emergencies. So we could have conditions like intussusception or telescoping, the volvulus, or severe dehydration from diarrhea. Symptoms could include abdominal pain, vomiting, absent bowel sounds. Management involves dehydration, imaging, and possible surgery. On stages of development according to Jean Piaget described 4 stages of cognitive development, where he starts with the first one, which is sensorimotor stage, where it takes care of the children from birth to about 2 years. Infants learn through the sensory experiences and motor activities. So there's development of object permanency. That's understanding that objects do exist even when they are not seen. And this normally happens at around 9 months. Pre-operational stage that takes place between the 2 years, children 2 years to 7 years. Children use symbols, language, and imagination, but lack logical thinking. So we still have egocentrism, where this is characterized by inability to see things from others' perspective. We also have an animism, which is attributing life to inanimate objects. From pre-operational stage, we go to concrete operational stage, that is between 7 to 11 years. So we have logical thinking developing, but is limited to concrete objects and events. So people here are understanding conversation, e.g., changing the shape of an object doesn't change its volume, and there is also improved problem solving. Formal operational stage, this is between 12 years and above. So here we have abstract thinking and deductive reasoning emerging. Adolescents can form hypotheses, can think about future possibilities, and engage in complex problem solving. So the last question was about the Master X, 3 years old child who presents with diagnosis of Wilms tumor at your hospital. You need to state 5 nursing priority diagnoses for Master X and outline the pathophysiology of the Wilms tumor, and then lastly describe management of this condition. So starting with the about 5 priority nursing diagnoses, we have risk for impaired renal function related to tumor suppression on the kidney tissue, acute pain related to the abdominal tumor growth and measure on surrounding organs, risk for infection related to immunosuppression secondary to chemotherapy or surgery, imbalanced nutrition less than body requirements related to decreased appetite and treatment side effects, anxiety related to diagnosis and upcoming treatment, risk for impaired skin integrity related to treatment modalities such as radiation or surgical incision, and lastly, risk for altered body image related to abdominal swelling, surgical scars, or hair loss from the chemotherapy. In terms of pathophysiology of Wilms tumor, we talk of the genetic mutation. As you know, Wilms tumor is associated with mutations in the genes such as the WT1 and WT2, and all these are found on the chromosome number 11, which regulates normal kidney development. So this mutation can lead to uncontrolled cell proliferation during fetal development, resulting into formation of nephroblastoma, which is the Wilms tumor. The tumor arises from primitive renal cells and typically forms a large encapsulated mass. As the tumor grows, it compresses adjacent tissues, potentially impairing renal function and causing hypertension due to increased renin secretion. In advanced stages, tumor cells may invade blood vessels or lymphatics, leading to metastasis, commonly to the lungs or the liver. The child may present with abnormal swelling, pain, or hematuria due to the tumor's effects on the kidney tissue and the surrounding organs. So, what about on the management? On the management, you could talk of the diagnostic workups, imaging. So, we could do abdominal ultrasound, CT scan, or MRI just to confirm the tumor size, location, and metastasis. Then, biopsies. This is rarely performed before surgery, but may be done if diagnosis is uncertain. Blood and urine tests will evaluate the renal function to rule out other causes. In terms of surgical management, we could do nephrectomy, which is removal of the affected kidney and tumor as the primary treatment. We also have lymph node biopsy, where it's performed to assess metastasis, chemotherapy administered pre and post surgery to shrink the tumor and eradicate residual cancer cells. Drugs commonly used include vincristine, dactinomycin, and doxorubicin. Radiation therapy may be indicated for advanced stages or metastasis. In supportive care, pain management, you can use analgesics like acetaminophen or opioids as necessary. Nutritional support, where you offer high calorie, high protein meals to counteract treatment side effects. Monitoring and follow up, we have the regular imaging and blood to work to monitor the recurrent or metastasis, evaluate for long-term effects of treatment such as chronic kidney disease. Psychosocial support, you provide emotional support and education to the child and family about the disease, treatment, and progress. You refer the family to support groups or counseling services. Also, in the preventing complications, you have to monitor for signs of infections, especially in immunocompromised children. And lastly, you need to assess for the signs of hypertension or fluid imbalances due to the renal dysfunctions.